My name is Anastasia Wallace. I'm going to simulate first aid on Giddy up here. So he has a fracture, and so the first thing you want to do is be safe and go ahead and muzzle the pet. I'm going to slide it on his nose from behind and clip it on there so that he can't bite us because he is hurt. We will then put him on the stretcher. His fracture's on his leg, so I'm going to keep that leg up. We move him to the table. And we're just going to do a quick makeshift tight split, just a really quick one, until the doctor can get here and keep the fracture from getting worse. So I'm just going to kind of put a splint on there and do a very quick wrap. Just to keep this from getting any worse until the doctor can get here and check him out. Layer of vet wrap. The splints I'm using is actually one that we could still do an x-ray of the pet's leg with this on here. And that will basically, it's just a quick one, but it will basically keep his fracture from getting any worse. So that is how we handle fractures. So now I will demonstrate how to handle bleeding. Alright, so now we're going to handle bleeding. This patient's been presented with bleeding. I'm going to wear gloves since I don't know if it's his blood or the owner's blood. And again, I'm going to muzzle the animal from behind, just to be sure, since we're hurt, that I don't get hurt. His wound is here on his leg, so I'm going to hold pressure to his wound. Go ahead and apply a tourniquet to the wound until the doctor gets here. It needs to be higher up on the leg. Put that pretty tight. Okay, so this tourniquet, we would loosen this every 20 minutes or so for about 15 or 20 seconds. Just to be sure we're getting proper blood flow, but we would keep him like this until the doctor can get here to figure out what the best course of action is. So that's how we handle bleeding. Handle burns, again we will wear gloves because we don't know if it's chemical that can burn him, if it would burn us, so we're gloved. Again, we're going to muzzle the pet since he's hurting. He might hurt us unintentionally. So for a chemical burn, basically, say it's right here, we would flush, trying to get all that chemical off. So we would carry him over here to the wash table. Obviously, we would carry him different than that, but carry him over here to the wash table and just flush this chemical burn, get all that chemical off that we can until the doctor gets here. Now, if it was a severe burn, we would basically hold a cold ice compress to the burn until the doctor gets here. That will take away some of the sting and also keep it from burning deeper layers of the skin. And that is how we handle burns. Okay, so this patient has been presented with choking. First, we want to see if we can tell what color he is, make sure his gums are a normal color, and they are not. He's got a blue tongue, he's not doing very well. So I'm going to open his mouth, move his head straight up and look down his throat to see if I see anything. And I do, so now I'm going to scrape that out of his throat, get it all out. He is still choking even though I have done that, so now I'm going to perform a Heimlich maneuver. I'll be on the abdomen right at the base of the ribs. And I'm basically going to just really hard, give him really hard squeezes. I'm going to try to, force air to come out of the lungs until he dislodges what was in his throat. So that's how we handle that. So now we will discuss how to handle a pet that's in heat stroke. He's been presented, they think he's in heat stroke. Looking at his ears, I'm seeing some broken capillaries, so I have to be confident he's in heat stroke. I will take his temperature. It is 106, which is very terrible, so we have to do something to get that down. We're basically going to wet this towel. It's soaking wet. We're going to put it around his neck here. kind of, help cool them off. Every time this, seems to get a little dry or not as cool, we'll re-wet it, I'd say every 5 minutes or so. We'll also take alcohol and just kind of squirt it on his paw pad, squirt this alcohol all over his paw pad, put it like a great place. Maybe put a little bit on his ears, on his abdomen, all these places where they like to lose heat. We're going to basically keep doing this until the pet, until his temperature gets down to 103.5, and at that point we're a little bit safer as far as getting his temp down. As I said, we re-wet this towel every 3 to 5 minutes or so as it starts to feel warm, and we just kind of keep soaking him down with alcohol. Maybe even if it's real severe, we can get some ice packs and just kind of rinse cold water through it and just really cool him off until it gets down to 103.5. And that is how we handle heat stroke. Okay, now this patient has been presented for shock. The owner believes it's in shock. It's not very alert. If you look at its gums, it's got really white mucous membranes. It's just really doing not very well. So I'm going to do a quick, just a tech exam to assess him, find out what I need to let the doctor know. So his capillary refill time, it's about 3 seconds. That's not a good thing. That shows he's in shock. We'll take his pulse. His pulse is pretty weak. I would say that that's another symptom of him being in a shock. His respiratory rate. I could probably count this, but I like to use the stethoscopes. So a dog this size, respiratory rate would be, around 25 to 30 or so. He's breathing about 80 breaths per minute. So it's not good at all. He definitely is in shock. Let's get his heart rate. Move his elbow to his chest. There's where his heart is. His heart rate is about 60, which is not too low for a dog this size, but still pretty low. And last thing, we would go ahead and check to find out, anything the doctor might need to know what's causing this. Is his temp. And his temp is low, it's about 97. So we will now give the doctor all this information and see what he thinks is causing this shock. With him being pale, slow CRT, and low temp, low heart rate, high respiratory rate, I would think that this patient is bleeding internally. But the doctor will be here to do his assessment himself and find out what the problem is. So that's how we handle shock. So this client's on the phone talking about her pet. She thinks it's been poisoned. So I'm going to kind of ask her a few questions about what she thinks is going on. So Giddy Up has been poisoned. What do you think he got into? He ate chocolate. Do you know what time he could have gotten this chocolate? About an hour ago. Okay, you have the wrapper of the chocolate to know what type of chocolate he got into. Okay, it was white chocolate. All right. Is he showing any symptoms such as, is he being hyper? Is he throwing up? Is he doing anything like that? He's not. That's a good thing. Okay. I will now tell the doctor all of these things and find out what we should do, if you don't mind holding on just one moment. So then I would go talk to the doctor, get the advice. We would say Giddy Up is a 60-pound dog that got into this chocolate. The doctor would probably instruct us to give maybe good 20 mils by mouth on a dog that size. Maybe we'll start with 10. So I'm going to get back on the phone with the client and tell her that. Okay, the doctor wants you to give about 2 or 3 teaspoons of peroxide by mouth and wait about 5 minutes and see if that makes him get sick. Now, if he does not get sick, we're going to repeat that, okay? So I'll call you back and we'll find out if he has vomited. Thank you, goodbye. And so then so then in a few minutes I'll call the client back and find out if it has gotten sick. So it's been a few minutes. Call the client back. Hey, has Giddy Up gotten sick yet? Oh, we did? Okay, was the chocolate in the vomit? Maybe some of it, but not all of it. Okay, either way, let's go ahead and have him come on in and make sure that we're not going to have any kind of toxicity poisoning from this, and let the doctor do an exam and make sure everything looks good, okay? Thanks so much. We'll see you in about 10 minutes. Bye-bye. Okay, and that's how we handle poisoning. Now I'm going to demonstrate how to handle a patient that's having seizures. So Giddy up here has been presented procedure. He's shaking it up on the ground. We basically don't want to touch him. He could hurt us. He could, he could hurt himself. So we're going to keep him away from everything. We're going to go ahead and just put a nice padded surface underneath him. That's about the most touching we want to do, is getting him on a padded surface. So we're going to be careful. We're basically going to time his seizures and just let him do his thing. So we'll also go ahead and kind of put extra padding under his head to be positive that we're not going to hurt ourselves. But basically you can't really do much besides wait on the doctor to get here with the anti-seizure medication. So we're just going to let him have his seizure without hurting himself. If he was to come off of this or go towards, something like that, then we would then block him and keep him from hurting himself until the doctor gets here to stop his seizure. That's about it.